Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
Now, how will you evaluate a child with a premature sexual development? So when she comes to you, you'll ask all this. What was the age of onset? So whenever a disease, a person comes with any problem, onset, progression, duration. Onset, progression, duration. So onset will be, age of onset is, when did she start? What was the sequence? How did it progress? And then family history. Like I said, idiopathic variations are 74%, correct? So you will go asking that first. And then you'll ask what neurological symptoms, because first of all, first thing that you want to do away with is to rule out the central causes, because peripheral are easier to teach. Central are actually the tougher ones, the ones which require more dedication and then long-term medication with their own side effects. So you want to just elude anything. So you're now asking for the neurological symptoms. And then you go on to asking, because if she doesn't have any neurological symptoms, she never had an injury, a injury, head trauma, no vision loss, no, fainting attacks, no blackouts. Did I say this thing, vision symptoms? No headaches, no complaint of any, what else do am I left with? Yeah, no history of chemotherapy, radiotherapy, or any, what else? Headache is covering almost all my traumas and tumors as well. And so is the vision losses. So yeah, mostly that. So you will ask all these things. When she says no, 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 no to all, then you'll go to ask any exogenous sex steroid exposure in food, drugs, cosmetics. You will ask her about a history of adoption or child sex abuse, because that happens. She doesn't even know that she's been given such medications which are making her, into an adult before time. That's a very important aspect. Very, very important aspect. Next. Clinical examination, height and weight measurements plotted using 8 specific growth charts, body mass index, pubertal Tanner staging, neurological examination of eyes including visual. So these are the things you'd like to do. First, just imagine, okay, let me ask my students. When a female comes to you with this history that my daughter is having premature changes or secondary sexual characteristics, she's got breast development at the age of 8, complete, fully, what do I say, adult sexual development. How are you going to proceed with this examination? Quickly write down the points and start with general examination, systemic examination, local examination. So please go in order. Let me hear what you have to say specifically for this particular case in which the female is having, or the small child is having, secondary sexual characteristics development at the age of 8 or before. Let's say 7-year-old girl has been brought by the mother in your OPD, and she has, let's say, premature breast development. And breast development, let's say, when you also see it's Tanner stage 3. I make it easy for you. Tanner stage 3. What else would you like to see in this girl? You've taken the history. You've asked her about her social life, school life, okay, about her peer group. You want to know more about her social life, actually. You want to ask about her family history, very important. Then, of course, about the neurological symptoms and what exactly is she having? What problem is she having? And, of course, her social history, even in terms of being adopted or as child abuse. So, yeah, let me hear. Guys, come on. Everyone, tell me the examination. What all would you like to see specifically in this girl? In terms of examination, how would you like to examine? You can all keep answering and we can join together and give a proper answer. All of you, just give me a minute, guys. So Pragati gets all the rewards, right? The gold medalist of my class. Okay, Anita is also very, very close contender. These two are. They are the stars. What about the others? So we have, who else is there? Pooja is there. Sunalika. Shrishti is there. Come on, Shrishti, I expect more from you. Satya, Nisha, Arsh is there. So I need to hear some answers, guys. I know all of you are there and you're trying to work for your exams, but this is just a brainstorming session. I just want to hear what you think. Suppose a patient like this comes into your OPD. You start from seeing her height, because you can't understand her chronological or bone age. Bone age is extremely important when it comes to precocious puberty. You cannot miss the viva, or you cannot miss the answer if you've not spoken about the bone age. You have to speak about the bone age. If the bone age is advanced as compared to the chronological age, that's a cause of concern. All right, you don't want that to happen, because then it'll be. Come on, answer me. If the bone age is more than the physiological age, what will happen? Answer you know already. All right, let me hear it from Arsh and Pooja. You can try. You can try, guys. Okay, wait. Yeah, very good, Anita. It's going to be a premature closure of the epiphysis, and what will happen because of that? Stunted growth. All right, so the bone age should never be ahead of the chronological age. It should go hand in hand, so that she can keep developing her height. There should not be a premature closure. You don't want that. This answer, I think everybody should be able to answer their sleep by now, correct? Yeah, so you start with seeing the height of the patient. You start with seeing the general condition, the body habitus, whether she's stocky, heavily built, she is having central obesity, a buffalo hump. All these are features of excessive cortisol. All these are features of Cushing syndrome, pigmentation, hair on the body, tanner staging of the breast. All this is general features. All right. You have to see about the body distribution of hair. All this is very important. Right. So then you start seeing the thyroid. Okay. If there's any thyroid swelling, is there a puffy face? If there's anything like, maybe alopecia, that is the, frontal balding, what does that tell you? What does that tell you, guys? See, so many Viva questions. If you're sitting right in front of me, if I ask you this question, you're not able to answer, I will not judge you as a good student. You should know this answer. It's a very, very basic question. Yeah, not androgen secreting tumor, just an excess of testosterone in the body. Frontal balding is actually a kind of a feature of male pattern baldness. And how does that come? When you have excess of androgens in your body, it could be because of anything. It can be even PCOS when you have more testosterone in the body, right? All right. So these things you will see in the general examination. When you go in for a systemic examination, that will be just chest and CVS and do the vitals as well. Per abdominal examination, just try to see if there is any, kind of lump or any mass that you feel in per abdominal examination. Local, you always see for the genitalia, because hypertrophy of clitoris, or ambiguous genitalia, which you will not find at this time, because that is obviously seen at the time of birth. But you can have those the non-classical kind of congenital adrenal hyperplasia, though you don't call it congenital in that case, adrenal hyperplasia in that case, right? So it's non-congenital, correct?